everybody. Time to learn about the assessment of the cervical spine. This is an online way of presenting information that my son is actually using in high school. So he was telling me about it and I thought it sounded kind of cool. So I wanted to try it to see if we could do it as a different way other than using Google Meet to get some lecture material for you guys. So today we're going to cover the assessment of the spine, and I'm going to do it in two separate videos. So the first one we should be able to get through the cervical spine, and then I'll do a separate video that's going to be the thoracic and lumbar and a little bit of sacrum. So I also know that you are going to be covering spine in orthopedic interventions, and so a lot of this is going to be repeat material, but you know, as we've talked about it before, it doesn't hurt to hear things multiple times, and sometimes maybe the way I say it or maybe the way Heather says it will help it click a little bit more. So, all right, so let's get started. So the cervical spine consists of 7 cervical vertebrae. So the first joint that we know of in the cervical spine is the atlanto-occipital joint. So it's composed of the concave superior facets of the atlas, or C1, with the convex occipital condyles of the skull. It's a condylar synovial joint that permits flexion and extension in the sagittal plane around the frontal axis. So you'll notice that some things on my slide are going to be written in red. So if you see something on my slide that's written in red, that means in your version of the PowerPoint that I posted in Canvas, those are left blank. So that gives you the opportunity to actually write that information in. And as we've talked about before, when you write in information, that tends to be the more important information, maybe to remember for some tests as well. So with flexion, you're going to have the occipital condyles gliding posteriorly on the concave atlas. And if we were in class right now, I'd be asking you guys, why is that? I'm sure you guys are getting all very good at the convex concave rule. So with flexion, you are going to have the head moving forward. So the occipital condyles, because they are convex, are going to move in the opposite direction. So with flexion, the head goes forward. So the condyles are gliding in an opposite direction, which is posterior. And then with extension, it's basically the opposite. So with extension, the head goes backwards. So the condyles are going to be going anteriorly or forward. So that's the atlanto-occipital joint. The next joint that you will see in the cervical spine is the atlantoaxial joint. So the atlantoaxial joint is actually composed of 3 separate articulations. You're going to have the median atlantoaxial joint, okay, right in here. And this is the anterior facet of the dens, or also known as the odontoid process of the axis. Notice again that's written in red, so you should be filling that in on your version of the PowerPoint. And that's C2, or articulates with the facet on the internal surface of the atlas, which is C1. It's a synovial trochoid joint that permits primarily rotation at this joint. So that's going to be the primary motion at the atlantooccipital joint is going to be rotation. So that is something to keep in mind, and that's pretty important. Okay? Then you have the 2 lateral joints. So that's composed of the right and left superior facets of the axis that articulate with the right and left inferior facets of the atlas. Okay, but again, the main motion at your atlantoaxial joint is going to be rotation, and that motion that's occurring with the odontoid process and the atlas. All right, and then there are a couple of important ligaments in the upper cervical spine. So the first ligament is the alar ligament that attaches the dens of the axis to the occipital condyles. Hopefully you might not be able to see it very well on this picture, but in your PowerPoint, I'm sure it shows up a lot better than this one. And the function of the alar ligament is to limit flexion, contralateral side bending, and contralateral rotation. So that would be opposite side bending and opposite side rotation. And then you have the cruciform ligament, and the name cruciform is used because it forms a cross. So it connects the dens to the foramen magnum, and that's the longitudinal fibers. So if you look at the part of this ligament that's actually going up and down or longitudinally, that's connecting the dens to the bottom of the skull of the foramen magnum. And then you have the transverse part of this ligament. Okay, so that part's going from right to left or left to right. And this is connecting the dens to the body of the atlas. Okay, so the up and down part, the longitudinal fibers, and the right and left or transverse fibers are all make up the cruciform ligament. And the purpose of that is to limit flexion and translation of the atlas on the axis. And in Heather's class, you are going to learn specific ligament tests, the alar ligament test and the transverse ligament test, which are very important because this ensures that the upper cervical spine is intact before any cervical procedures are done on a patient. So those are things that you will be learning in orthopedic interventions. I also included for you guys a video on the atlantoaxial joint. It's a really great video. It shows movement, a 3D perspective, and really helps you get a better understanding of exactly what's happening at the atlantoaxial joint. So please take some time to click on that and watch that video as well to get a better understanding of the atlantoaxial joint. All right, and then throughout the spine, as you guys know, there's also the intervertebral joints. So these are composed of the superior and inferior surfaces of the vertebrae. So the superior surface of one vertebrae the superior surface of one vertebrae and the inferior surface of the superior vertebrae with the disc that's in between. So the discs are those cartilaginous joints of the symphysis type, which allow for flexion and extension and lateral side bending and rotation. So the intervertebral joints permit a small amount of sliding and tilting of one vertebrae on another. Okay, and so I actually have the next slide will give you a better visualization of that. So you can see with flexion, you're going to have an anterior sliding and tilting of the superior vertebrae on the disc of the adjacent vertebrae below. So with flexion, you have anterior sliding and tilting. And then with extension, you can see that there's a posterior sliding and tilting. So it's going backwards of that superior vertebral body and the inferior vertebral body with the disc in between. Throughout the spine, you're also going to see zygapophyseal joints. Okay, so this is just another word for those facet joints. So these are formed by the right and left inferior articular facets of one vertebrae, the superior vertebrae, and the right and left superior articular facets of the adjacent vertebrae below. So again, it's composed of the inferior facets of the superior vertebrae, and then the superior facets of the inferior vertebrae. So that's going to be what is causing the joint surface. Okay, so each of these are reinforced by individual joint capsules and ligaments, which are pretty lax, and so they allow quite a bit of motion throughout the cervical spine. So these joints allow for flexion and extension, lateral flexion, and rotation. So the movement taking place at the zygapophyseal joints. So with flexion, you're going to have the inferior facets of the superior vertebrae sliding anteriorly and superiorly on the superior facets of the inferior vertebrae. So take a little bit of time to think about that. I was looking very hard to try to find a video that would actually show that motion, because in years past this tends to be a movement that is somewhat hard for students to visualize. And even the model of my spine didn't show it very well. But you basically, again, for flexion, you're going to have the bottom facets of that top vertebrae are going to be moving forward and up on the top facets of the vertebrae below. And then extension is just going to be basically be the opposite. So your inferior facets of that top vertebrae are going to be going backwards and downward on the top facets of the vertebrae below. And then with lateral flexion and rotation, that tends to be even a little bit more confusing even than the flexion and extension. So for lateral flexion and rotation, you're going to have the inferior facets of the top vertebrae going down and back on the side that they are flexing to. So on the side that is being, the spine is flexing to, side bending to and rotating to, those facets on the top vertebrae are going to be going down and back. And then on the opposite side, so the opposite side of the side that's side bending, those bottom facets are going to be going up and forward. Okay? So again, I tried my hardest to find a video that would explain this a little bit better, and unfortunately I wasn't able to. I know this says arthrokinematics of the lumbar spine, and we are not to the lumbar spine yet, but this was the best visualization that I could get for the lateral side bending and rotation. So you're really not going to be able to see as much of the forward and backward motion as you will see the down and up motion. So you can see with side bending to the side that they're side bending, this inferior facets of one vertebrae are going down and back on the side that they're side bending to. And then the opposite side, the side that's opening, those inferior facets of the superior vertebrae are going up and forward. So again, it's hard for you, I know, to see the forward and the backward part, but you can at least see the downward part and the upward part of the inferior facets of the superior vertebrae. Okay, so again, the zygapophyseal joints are the inferior facets of the superior vertebrae and the superior facets of the inferior vertebrae. Okay? All right. So we also need to talk about some ligaments of the lower cervical spine. Okay? So you're going to have the anterior longitudinal ligament that reinforces the anterior portion of the intervertebral disc in the vertebrae. It's going to limit extension. Okay? So if the spine is trying to go backwards, and you can try to do this as you're listening to this video, if you're trying to go backwards, it's going to be the anterior longitudinal ligament that is taut. Okay? And then the opposite for the posterior longitudinal ligament, which reinforces the posterior portion of the intervertebral disc and vertebrae, and this limits flexion. So if you bend forward, you can feel that it would be the posterior ligaments that would be limiting that flexion motion. And then I included a picture of a vertebral body up here just to give you a visualization of the last four ligaments that we're going to talk about. So the interspinous ligaments, those are located between the spinous processes of one vertebrae to another. Okay? And they're going to limit flexion and rotation of the spine. And then you have the ligamentum flavum, which connects the lamina of one vertebral body to the next vertebral body. Okay? And this is going to limit, these ligaments limit flexion and rotation. You're going to have the intertransverse ligaments. Okay? So they're going to link the transverse processes of the vertebrae to the next vertebrae, the transverse processes of a vertebrae above and below. And these limit lateral flexion. And then you have the ligamentum nuchae, which attaches from the occipital protuberance to the C7 vertebrae. and this is going to limit flexion of the spine. And so this is a good picture of the ligamentum nuchae, right here. Okay, and then just ending up the cervical spine is another cervical spine video that I found for you guys. And again, I really like these two videos that I was able to find because they give you a really good 3D visualization of all the many different structures of the cervical spine. And I know many of you are visual learners like myself, so sometimes it's helpful to actually see from a visual standpoint what is happening in our spine.